Hello, in this video we will discuss medical error as a topic for communication skills, station number 4. We discussed in the first video a complete overview about communication skills, about station 4. In this video we will take this topic as an isolated topic, how to deal with medical error. After the introduction that we speak about in video number 1, you will go directly now to deal with your angry patient or your angry relative and to admit first that there is error happened. Because by duty of contour, we are not hiding information from the relatives or from that patient. So admit that there is error happened. Second step is to apologize about this error. Please don't say only I'm sorry. Say we are apologizing. Who is we? We is the team. Because in medical error, there is no single person can be accused. So the team, the whole team will apologize about this error. So always in the scenarios of medical error, after you are admitting that there is error happened, we use we, not I. We are apologizing, not we are sorry. It is different. So we are apologizing for happening this error. Then you will go for the third step. Third step after admitting and apologizing is correct the medical issue happened due to this error. Let's take an example. So if the medical error patient who is not diabetic, by mistake he took insulin. So he got hypoglycemia. So you need to speak about the medical correction action of the error that happened. That we reform the multidisciplinary team. We catch the error early and we give him dextrose, we give him sugar, we give him sugar through a needle in his blood channel. So he became oriented, he became conscious again, he is okay now, there is no problem happened to his body, he is now dealing well and fully conscious and oriented. So after you admit there is error, you are apologizing as a team for the error that happened, you correct the medical issue happened due to this error as a team management. Then you will go for the fourth step, which is investigating this error. So how you will investigate this error? You must say that we wrote an incident report. And the name is incident report, not incidental report. Because some of the candidates say incidental report. Incident report. So we already wrote incident report. And this incident report submitted to Root Causes Analysis Committee. And here I have a comment. Some of the candidates say this incidental, which is not incident, it's called incident. Incidental report submitted to the risk team management. So two mistakes now. The name is incident report, not incidental. And the team who will discuss, who will investigate this incident report is called Root Causes Analysis Committee, not Risk Management Team. And here we need to differentiate between both. Because if your examiner is quality oriented, he knows exactly the difference between both. And he will not accept that you don't know the difference between both. So the Root Causes Analysis Committee is a committee which is discussing and investigating the errors that already happened and informed by the incident report. But the risk management team, risk management, they are dealing with the future expected risks, future expected hazards. So the risk management team is the team who is discussing the hazards that may happen in the future and put a plan that will be implemented in the hospital to prevent this potential hazard from happening in the future. So I want all of you to know the difference. I don't want any one of you to have confusion between both. Summarizing again, so we will admit that there is error happened. We will apologize. We will apologize for that error. We will speak about the medical correction of the medical issue happened from this error. Then we will investigate the error. And investigation by writing the incident report. And this incident report will be submitted to the Root Causes Analysis Committee. And this Root Causes Analysis Committee will discuss this incident report in a confidential manner till finding the gap in the system. Again, finding the gap in the system. So, any error is due to system error, not single person error. Never say one nurse did an error. Never say one of our colleagues did an error. Don't say junior doctor did an error. Please say that this root cause analysis committee will discuss the errors that happen to find the gap in our system that causes this error, to give us the recommendations, the policies, the procedures, and the actions that will be taken in the future and implemented in our hospital to prevent this error from happening again, either to your father, if you are speaking with the son of a father, or any other patient in our hospital. So this is the root causes analysis committee and the actions that will be done in a confidential manner to find the gap in the system, not a single person error, and to implement policies, procedures, work instructions, and correction plans to prevent this error from happening again in our hospital. There are other committees that may happen to relieve the bad feeling and the hard feeling of the patient or the relative, like the morbidity and mortality committee, like the monthly meeting of the department. Make sure that you know the difference between the official meeting of the morbidity and mortality committee, which is confidential and no one can attend, and also the official meeting of the monthly meeting of the department, which is confidential and no one can attend, and the unofficial meeting. So after finishing the official meeting, we can offer some time to the patient or to the relative for the errors that happened to come and attend an official and confidential meeting. He can attend it just as a brainstorming, discussing only what happened in this error, and take ideas, take the feedback from the patient or from the relative, give them a space of sharing their thoughts instead of going to the court and speak with the court against your colleague or against your hospital. So, after admitting there is error, apologizing about the error that happened, and the medical correction action that you did as a hospital, as a team to correct this error, and investigating official investigation of the error by the incident report and the root causes analysis committee, some committees to relieve the bad feeling of the patient or the relative, the unofficial one. So after finishing the official morbidity and mortality committee, we can invite this relative or this patient to attend 10 minutes with us without discussing any other cases, just to give him a space to give his thoughts, his ideas as a brainstorming, to relieve his bad feeling, to give him some support and help. After finishing all of these, we have the meeting with the consultant. He will sit down with this patient or this relative to give him another idea how we are correcting the error that happened and preventing it from happening again. Something more I need to add: if your patient or your relative is refusing whatever you did and told you, I am not convinced and I want to submit an official complaint, At that time, after you did your best to convince him that we are taking the matter seriously and we are doing our best to correct it, and he is refusing and not accepting and insisting to submit official complaint, now you will offer for him to go to the PALS, which is the Patient Advisor Liaison Services Office, where he can submit his official complaint. Please verbalize that I will guide you. Don't say I will help you. I will guide you to the PALS, Patient Advisor Liaison Services, where he can submit his official complaint and he will receive the result of investigating his complaint within 3 weeks, within 4 weeks, according to the policy of the PALS. These points that I want to discuss in this video, it's taking the medical error from the start point to the end point with the hidden agenda that may appear, that he is not accepting what you said and he wants to submit an official complaint. Another hidden agenda that is repeatedly come in the exam from the surrogate, asking for the name of the doctor or the name of the nurse that did this error. As I said before, there is no one single person can be accused that he is the one who caused this error. So always defend your colleague and say the team, the whole team treating your father or treating you or treating your mother is responsible for whatever happened to your mother or to your father. And no one can be accused for as a single person that he caused this error. So always defend your colleague and speak in a we manner, in a team manner, to take the full mark in these types of the scenario. Thank you. So till we meet again, discussing another topic, all the best for all of you.